What creates a monster, nature, or a system that enables them? Plano, Texas, a middle-class suburb where success stories begin. Christopher Duntsch's story started like many others: a physical therapist father, a teacher mother, stability, privilege, and promise. By college, that promise seemed destined for fulfillment. Star football player at Millsaps College, obsessive dedication to weightlifting. A mind that would earn both an MD and PhD, but beneath the accolades, something was wrong. At the University of Tennessee Medical Center, the cracks began to show. 72-hour research binges, failed drug tests, cocaine and LSD use, and a stint in a rehabilitation program. But somehow, despite all this, he kept advancing. Fast forward to Dallas, 2011. Duntsch arrived, presenting himself as a medical revolutionary. Luxury cars, designer clothes, claims of surgical breakthroughs, and millions in investor funding. He was the best surgeon in Dallas. But what happened next would shock the medical community to its core. At Baylor Plano, patient 1 Jerry Summers, Duntsch's childhood friend. A routine cervical fusion left Jerry waking up as a quadriplegic. Duntsch showed no remorse. 1 month later, Kelly Martin. A simple procedure led to massive blood loss and a fatal outcome. Yet Duntsch kept operating. And so began the pattern: resign before investigations, move to a new hospital, start fresh and leave devastation behind. Enter the heroes of our story, Dr. Robert Henderson and Dr. Randall Kirby. Henderson, called to repair Duntsch's work on Mary Efford, found screws in muscle instead of bone, severed nerve roots, basic surgical principles ignored. To him, this was no accident, it was criminal. The numbers were staggering: 37 surgeries, 33 patients harmed, 2 dead, countless lives destroyed. But Duntsch kept operating. Then investigators found his manifesto, an email where Duntsch wrote, "I am ready to become a cold-blooded killer." Dr. Kirby's fight began. He wrote letters to the medical board, warned other hospitals, pleaded with law enforcement, gathered evidence, and built the case. The breakthrough came with the police investigation. A pattern of intentional harm, multiple witness statements, surgical videos showing basic mistakes, evidence of substance abuse, and a history of erratic behavior. In 2017, the trial began. 13 days of testimony, 35 witnesses, hundreds of exhibits. Christopher Duntsch became the first surgeon criminally prosecuted for malpractice. A historic case, the sentence life in prison, eligible for parole in 2045, still claiming innocence. The aftermath changed medicine forever. Enhanced reporting requirements, better hospital communications, stricter background checks, faster medical board action, and new patient safety protocols. Today, Christopher Duntsch sits in prison, still maintaining his surgical excellence. The grandiose personality, the God complex, unchanged. The true cost: families destroyed, lives altered forever, trust in medicine shaken, a system exposed. The most chilling aspect: Christopher Duntsch wasn't an imposter. He was a fully trained neurosurgeon who combined technical knowledge, a narcissistic personality, substance abuse, system failures, and a complete lack of empathy. His story isn't just about one bad doctor. It's about how charm, credentials, and confidence can mask a monster. About how a system designed to protect can enable instead. The next time you meet a doctor, remember, credentials don't guarantee character. And sometimes the most dangerous predators are the ones who truly believe in their own infallibility. The system didn't stop Christopher Duntsch, 2 dedicated doctors did. Sometimes the only thing standing between a predator and their prey is someone willing to speak up. Subscribe for more medical true crime investigations, where we examine the cases that changed medicine forever.